Is connecting home, school, and community. I'm just really talking about a sustainable model to really build those prevention services into the school-based communities, specifically in South LA, but really talking about how to broaden that into the state models. There's a little lag on my slides, so give me one second. But I'll introduce myself to start. I am Christina Ramirez. I am an LCSW with Shields for Families as the Behavioral Health Services Administrator.
Hello, everyone. Welcome. Thank you for being here. Hopefully, everyone has either their natural or artificial sugars to keep them going through this last bit of the afternoon. My name is Danielle Lowe. I am a PsyD and a LCSW as well, and I'm the Behavioral Health Services Director at Shields for Families. So, thank you all for joining us.
So, just talking about some goals today, we really want to talk about how we can co-locate services within the community schools model and how that just strengthens access, especially for populations that have not really been included in the prevention services or the behavioral health services. We'll talk about CYBHI billing, how we can leverage that fee schedule program to really sustain the work that we're doing within schools. We'll talk about how school-based services can function as just a great entry point for families to get connected and involved in the services that they need. So it can include home visiting, cultural broker, preventative legal services, a lot of the services we've been hearing about today, just how schools can be utilized as great entry points for families. And then walking away with at least two strategies for building those partnerships across sectors, and then how that integrates into the comprehensive prevention plan within the state through community pathways. If that sounds good to everybody, we'll keep going.
Okay, so just going to set the floor with a little bit of groundwork. Yes, we like the thumbs up, interactive. We are open, free flowing. So if you guys have questions, comments, they are welcomed. So just starting off with giving a little context to the area that we service in particular. We are within South Los Angeles, so really that SPA 6 region. And so we just want to set that groundwork just so you all understand who we're working with and the why behind our models and our practices. Before I do that, I do love to give the disclaimer that we will be highlighting African American and Indigenous families because they are still the most impacted within a lot of our systems. When we're looking at the school system, at the child welfare system, criminal justice system, we still see that disproportionate rate with African Americans and Indigenous families greater in comparison to our other counterparts. And so we are not trying to exclude anyone. We just want to highlight those that are most vulnerable because our mission, I'm sure all of you as well, is if you fix the systems for those that are most vulnerable, it will be rectified for everyone else that becomes or encounters that system, I should say. So I got my disclaimer. So just want to highlight LA County and our SPA specifically. And so want to go over the population. African Americans in LA County there's about 7.6% within the whole LA County. However, in SPA 6 alone, the percentage is 28%. And so you'll hear a lot of our language focus because we still have a very high population of African American families within that SPA 6. And then in relation to our child welfare system, because this is why we are here, what has brought us together, really want to highlight just the impact of child welfare involvement. Next slide, sorry, child welfare involvement with our families. And highlighting that still today, we see a great disproportion of African American families and Native families involved within the system, having a rate of 1 in 2 becoming involved at some level within the child welfare system. So we really see that 50% chance of our families becoming involved with the system. So all of this just letting us know that we still have a lot of work to do. We are, doing the work, we're noticing, we're collecting that data. And so just being very intentional about our steps when it comes to intervention and supports to families within communities.
So, just sort of getting into our roots of Shields and how we got into this work, and then sort of how we ended up in schools. And so, our agency, Shields for Families, was founded in 1991 after the crack epidemic was really hitting the South LA community very hard. And so, what we were seeing at that time is that babies were born prenatally exposed to substances and removed from their mothers like right at labor and delivery. And through the system, there just wasn't any plan for reunification at the time. The model was very much like remove from children because the parents have this like flaw. That was sort of the perception at the time. And so children were not given the services that they needed, and mothers were not given the supportive treatment services that they needed. At this time, all funding was going to incarceration, law enforcement. There was very little funding going to treatment. So our founders, Dr. Eisenhower, who if you were around in some other workshops, she's still here, and has some influential work still continuing that prevention work. Dr. Exelina Bean, she was head of pediatrics at MLK Hospital. And then Norma Intume was working with Kathy at the county. And so their thought was, what would happen if we provide a family-centered treatment to the mothers and their children and their entire families, allow them to stay with their children, get the substance use treatment that they need, and get the children involved into um, child development services. What would happen? Would we see families that are able to stay together and really overcome these obstacles? And so that was our Genesis program, and it was very successful and continued to grow from there. And what we saw really as children were getting into school aged, there was still a lot of lingering behavioral health needs as they entered the school system. And so because of that system involvement, the parental substance use, the instabilities in the family, there was just a lot of behavior showing up in the school. And so we took our services to the schools where the children were. And through that, just supporting in schools really just became like a natural consequence of what we were doing. Word spread very quickly that we can be involved in schools. And so we went from like one school that most of our kids went to now in over 80 schools in South LA. And so, what we've seen is with schools, there is just a lot of system involvement that sort of the entry point into a lot of these systems can happen in the education system. And so, it really does create just this perfect storm of future and further system involvement for families, where we know educators are the most frequent reporters to child welfare. And we also know the more likely you are to have disciplinary practices in the school setting, the more likely you are to be in the criminal justice setting. So there's just like this perfect storm of like system involvement and these pathways that are leading families into further system involvement. But that also gives us opportunity. So if we see these pathways that are leading where we don't want them to lead, it gives us a chance to say, okay, how can we interrupt those pathways and provide some supportive services and prevention work for families so we aren't making the system continue to perpetuate itself? I like this because it is true. We didn't start in schools because schools asked us to. We just showed up and the families brought us there. There was a need and we were meeting the need. And then the just word spread that we were able to meet the need there. And so continuing to drive from there.
Yes, so really focusing on that participant voice, which is key to that family-centered treatment model. And from our family-centered treatment and listening to participant voice, we really did see the impact and the need within the school systems. Definitely want to highlight and support our school partners in saying we know that the system just was not built to provide all of the supports that youth coming in that have child welfare involvement or other system involvements, there just aren't equipped with enough people or maybe the trainings to support or provide the supports needed. And a lot of the times that mandated supporter training, well, now mandated supporter training is really just report, 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 instead of here are some tools, here are some resources that you can utilize. And so for us, it was really important to say, hey, this is where our children are going to be for 8 hours. Let's go in and really form these modern villages to support our families, support our students, so everyone feels welcome, and that they can actually navigate through the system appropriately and reach their goals. And so what we saw with our youth, and in particular our older youth, because of child welfare involvement and the way child welfare really reacted to families with substance use, in the past, we saw a lot of foster care placements. So that meant a lot of different schools, separation from siblings, separation from, of course, their parents. And so you saw all of these externalized and internalized behaviors, which naturally so came out within the school setting. And so with that family-centered treatment model and children coming home or reunifying with their families as the families were navigating their sobriety journey, we were able to really form, again, this modern village and go into the schools to offer these supports, to offer trainings, to really address those behavioral needs that our children were displaying within the academic setting. And so we really just, again, started from that SUD lens and quickly moved. We started in 91 under SUD and then really moved into behavioral mental health in 97 and just continued to expand those services after that. And I think we can go to the next one. Perfect. And so this is just another really transitionary slide, just highlighting, the impact of family instability and trauma and how that can impact the behaviors within the school setting with the children and the work that we have to do as providers within all of those systems to ensure that families are supplied with the actual safety net and supports that they need in order to truly navigate and meet those individual and family goals.
All right. So as we've continued to move, being in schools and just having, like Danielle mentioned, we started mental health services in 97 and just continuing to see disparities in youth mental health, and they're continuing to widen, especially post-COVID. But what we see is just disproportionate adverse childhood experiences for Black and Indigenous families. So in California, they're more likely to experience more than one adverse childhood experience. And then we really see data just consistently over the years, even over the decades, just showing that the more likely you are to have out of school suspension, expulsion, things like that, the more likely you are to have criminal justice involvement. And a SAMHSA study that we will talk a little bit more about, but they've listed some barriers to access to care that African American families have identified. Structural inequities, stigma, just limited access to culturally responsive care. And as a result, our Black and Indigenous families are more likely to receive care under acute crisis. So they are more likely to get mental health services through an emergency room versus like the prevention, early intervention, and those long-term treatment models. And so that kind of highlights that we have a need and we have to adapt how we're trying to meet that need for these communities.
And we are going to do a short video. It's 2 minutes. Hopefully everything works well tech-wise.
Fingers crossed. All right, I'm going to press play and just pray.
What would you do if your child was placed in handcuffs for crying at school? Well, this was a reality for a 7-year-old Black boy in Missouri, and it isn't rare for Black and brown kids across the country. Whether it's getting arrested for talking back or doodling on a desk, in-school policing is harming students by taking them out of school and helping funnel them into prisons. It's called the school to prison pipeline. We're talking about a structure of codes and punishments that criminalizes kids as early as preschool and increases their chances of ending up in the criminal justice system. 99% of New York City school children who were handcuffed in 2016 were Black or Latinx. This happens when school resource officers are called into classrooms to discipline students, sometimes for something as small as violating a dress code or grabbing candy from a teacher's desk. If the offense doesn't lead to an arrest, Black and brown students are still subject to harsher punishments than white students. Black students are 4 times more likely to be suspended than their white peers. Sometimes students are kicked out of school for basically just being Black. Like in cases across the country where Black girls were suspended for rocking braids or an afro. So, where do students go after they've been kicked out of school? Research shows they're 3 times more likely to end up in the juvenile justice system within a year. This is all part of an endless cycle. Once kids touch the juvenile justice system, they're 67% more likely to end up in jail again before they're 25. So, what lessons are schools and police really teaching our kids here? How can kids excel in school if they're always being kicked out of them?
Yes, promise, short and sweet to the point, but really just highlighting the why we need to be within schools. And again, really just providing those supports that our children need within that school system. It's unfair of us to ignore the consequences of our system and the way that the systems were set up for our children. And so what we're doing is really trying to go in and not only provide that individualized support to the student and to the family, but also provide that individualized support within the school system. So really looking at admin teams, looking at policies and practices that are within the school system, so we can actually have that paradigm shift where we're not as punitive, but we're providing more supports to our youth. So this highlighted, this is just a very general overview, but the next slide that we're going to look at is really looking at that achievement gap and just showing that we still have a great achievement gap when you look by race, and we're looking at those that are not meeting the standards when it comes to those assessments. So that math assessment and the ELA assessment. So we see that still African American and Indigenous students have a larger achievement gap when it comes to meeting the standards. The next slide is highlighted as well within that video are our suspension rates. And so this really gives us that tool and that data that we need to say the lens in which African American students, Indigenous students are being viewed through and reacted to is very disciplinary and punitive. And so that gives us the tools that we need to say, hey, let's come in, let's address some of these policies and practices. Let's address some of these inherent biases that are within these practices and policies and how we're viewing students, because we know if they're suspended, that means they're not at school, which impacts their ability to learn and also, more importantly, impacts their connectedness within the academic setting.
So what we have really in the school setting is we really have like a perfect storm where there's disconnection from a supportive adult and stable school environments, home and community stressors, and then really a decreased academic ability to engage because of those resources. And it really shows up in a compromised emotional regulation, and then just continues to perpetuate that cycle. Reduced educational attainment as a result of that, and then just that low school connectedness. It's very, very important. And so we'll kind of talk about how that impacts mental health when there's a low connection to school. So this graph shows students who feel connected to their schools. And this is national data about school connection. So students who feel connected to school have substantially lower prevalence of poor mental health outcomes, substance use, and related risk factors. So we can see that school connection has a positive impact on mental health, whereas a low connection has an increased risk factor ability. So you'll see more long-term marijuana use, opioid use, and things of that nature when you have a low connection to school. Among Black students, high connectedness is associated with 20% of poor mental health versus 32 among low connectedness students. So really, this national data shows that students who feel connected to their school are significantly less likely to experience those poor mental health outcomes or engage in substance use. So it shows us that there is a lot of area for intervention. If we can increase connection to school, connection to community, we can also increase positive mental health outcomes. This one shows just by race the outcomes. So with Indigenous families, they have reported a 19% high connectedness. And so again, that's lower than the national average and impacts mental health outcomes. So 44% of Indigenous families have reported low connectedness, impacting more likely to have lifetime marijuana use and opioid use and poor mental health outcomes. All right. So, with all of that kind of just compiled here, what our data is really showing us is that we can see it really impacted on many different systems and how it impacts mental health. So, Black students receive exclusionary discipline at much higher rates. We've talked a little bit about that. So, it's almost 4 times more likely than white students to be suspended or expelled. And this data was showing for same infractions. And so that's how they measured more likely to be suspended or expelled for the same infraction. So CDC shows that 23.1% of Black high school students reported receiving unfair discipline, and that's compared to 18% of Hispanics and 18% of white students. So it's significantly higher. In some districts, Black students have been found to be almost 4 times more likely to be suspended and out of school than white students. And then I thought that this one was very interesting, but for Indigenous families, students also experience disproportionately high discipline rates, often well above their enrollment share. So in some of the data sets that we were looking at, the absolute value of disciplinary is significantly higher. And so it's not even proportionate to the population that's there. It's just absolute value was even a lot higher. So we can see that there's just a lot of levels in the education system that are impacting that further system involvement and school to prison pipeline.
And continuing with all of our lovely data, just highlighting also, we cannot exclude the conversation of discrimination and racism and the impact of discrimination and racism on our students, on our disciplinary action, and just within the culture of that academic environment. And so just wanted to highlight that still in 2023, we have reports from students saying that they've experienced like clear racism within the academic setting. And the impact of that is we are seeing mental health impacted there. And especially when we look at some of our coming numbers and data, we will see that increase in suicidality amongst African American groups has increased to the highest level that it has been as far as data has been able to collect. And then, so we can go to the next slide. So we really wanted, here it is right here. So with our African-American teens, we see that we have an increase in suicide attempts in comparison to our white teens. We see that it's now, as of 2019, the second leading cause of death for African-American students aged 15 to 24. So we know that we have the opportunity to go in and provide a lot of intervention within the school to support with preventing these numbers from continuing to increase over the years.
This data is from SAMHSA, and this is just showing for African American youth and adults that we have not set up a system that's approachable and welcoming and attainable for African American families. We have set up a system that does not support their needs. And so that tells us that there's really a lot of work that we need to do on how we deliver systems and how we access communities that really need support. So, for example, 12-year-olds, 12 plus that have a substance use disorder, 88% of them do not receive any treatment at all. And so that really is telling us that we have a huge population that needs services and is not utilizing them because we have not set them up to be approachable and welcoming. Um, 91% of individuals 18 and over who identify as African American, 91% do not receive treatment for co-occurring disorder. And so we have a lot of work to do in our behavioral health field to make services more accessible for families that truly have demonstrated a need. In this SAMHSA study, barriers to access to care were identified by participants to say stigma around mental health, um, very, very justified distrust of the healthcare system, lack of culturally competent or representative providers, and then underinsurance or no insurance.
And so for us, we said, okay, let's look at schools as a protective factor and what can we do to ensure that they are a protective factor. And so we know the impacts, right? Through all of our data, we can see the impact if youth do not feel connected, if schools are not set up to be culturally and trauma informed, if they're not looking through the lens, a critical race theory lens or that lens of intersectionality, we see the impacts, right? And we see the impact on our youth and our families and then our communities ultimately. And so it was really key for us to take that family-centered treatment model that we utilize within our substance use programs and then really just embed that within, again, these systems that our families are directly in contact with every single day. Our youth are there every single day and really create that family-centered model within the school system and advocating and supporting if that's not seen or if it's not possible, advocating and supporting for other alternatives that best support our families and communities.
Yeah, so this is how we sort of transitioned or expanded really our Genesis family centered treatment model into the school setting. And so here's just some tenets of family-centered treatment. The first is that the family truly is the client. And so treatment is family focused, not just individual. So we're saying the whole entire family is going to get the services that they need, versus just traditional outpatient treatment where you get the problem, you have it, you get the treatment, and then go back to your family, right? And so, we really do view the family as the true client. And then relationships drive outcomes. That is really essential to the work that we're doing. And we truly believe in schools, you're able to build a relationship with a student that really serves as like your entry point for the whole entire family. And so we have very high expectations for our staff on really building relationships and building trust. And then we allow the family to define itself. So if that includes mom, dad, brother, sister, great. And if it includes stepmom and coach or pastor or a supportive teacher, that's great. We want to include whoever the individual identifies as their family. That's who we're going to include in their treatment. And then inclusive planning to make sure that the family is allowed to have their own autonomy. We know our families have a lot of system involvement, and systems aren't set up to have families have autonomy in what they're going to do in order to meet their requirements, right? If they go to child welfare, if they go to court, the judge tells them, here's exactly what you need to do to get your kids back. We don't want our services to feel like that. It should feel like the family has voice in what they're participating in. We can say, hey, here's what's available, here's what I think can help, and allow them to just pick what works. We're going to be here regardless. So if they need to handle housing for now and they want to wait on substance use treatment, that's totally fine. We're here if you ever change your mind. So making sure that families are involved in that case planning is very important for us.
So, kind of the process, and a lot of this was really organic. I'm going to be real honest with y'all. So, targeted school engagement, what really happened was our families that were enrolled in our substance use treatment Their children, we supported when they returned home or if they were in their care. We supported with enrolling them in school. So really walking through with that caregiver, if they needed that added support, walking them through what that process looks like up front, enrolling in school. If their student required any additional supports, like either a 504 or an IEP, just walking them through and being that advocate to support them with that process, right? And also supporting with eliminating that fear that the school would call for some unwarranted reason with them walking in to enroll their child who might have not been enrolled in school for a month or so. And so we really supported there. And then, of course, with the transition to a new school, sometimes a new home for a lot of our youth, you did see some externalized behaviors happening within that school setting. So a lot of these schools were like calling us left and right. Hey, this kid, hey, this kid, this kid, this kid. And we said, okay, well, can you allow us to come on the school campus? And the schools are like, yes, anything. Can we sit in the classroom? Yeah, sure. What are you guys going to do in the classroom? We're just going to observe. We're going to reinforce behavior, support with redirection. Can we go on the blacktop and watch them interact with their peers? And so it really just organically happened with the schools where we were like, we want to support you all. So the educator is able to get through their lesson. We're supporting all the other students within the classroom and supporting our individualized student as well with being able to sit and learn and participate within that classroom environment. So it was very organic in nature. And of course, the grapevine is very fast around here. They're like, hey, these people will come sit in class with your kids. And so they really just started passing our names around to other schools within the district. And then it really became a lot more formalized over the years of us providing services. And so with that passing along, we were able to really have standardized MOUs with a lot of the school districts. And then, of course, now having those formal service delivery applications with the individualized schools. And then when charter schools came to be, also establishing those formal relationships with them as well. And we were really able to then not only say what we can provide, but also have this agreement of what the school was committed to do as well. So also having that buy-in from the school and the district with, hey, this is what we're going to do too, because we also want to be a part of changing this narrative and supporting these youth and these students and these families in our community with progressing. And so we really were able to then leverage this back and forth relationship and an actual partnership and collaboration with schools as we continue to grow and provide services throughout the year within the school. And I kind of said that. So what it looks like now, co-locating our clinicians on site. So we'll have master's level clinicians on site as well as bachelor's level supportive staff on site as well to support with some of that navigation and just follow up in psychoeducation. We do a lot of cross training. So we do provide staff trainings for all of the educational staff as well, really highlighting how to create a culturally informed classroom environment, how to support with trauma-informed interventions, and again, doing a thorough analysis of those disciplinary processes or practices to ensure that they're aligned with really supporting the behavioral health needs. And again, we don't coddle, we hold people accountable, but it's the approach that best supports and has those better outcomes to ensure there's connectedness. Students can feel and see themselves within the classroom setting, within that academic setting. And then we're really progressing towards those family goals and community goals. If you have a relationship with family, you're more likely to pull them in and have a conversation versus just calling to report or consult out, right? So really changing it from that transactional interactions to relational interactions. So really focusing on that relationship building and then making schools a hub of resources. So with us being on site, you can come in and you can ask. A lot of schools that we partner with, they'll have resources for parents and other community members, whether it's something as simple as laundry detergent, deodorant, lotion, Vaseline, just all of those tangible resources where people can go in to access, or having a list of resources that are available within the community that they can access, food banks, shelters, different items like that. So now it's not a fear to come in and ask and see the school as a partner. It's this is part of my village that will support me, and I can ask for help without the fear of these punitive responses.
Yeah, so as part of our really like comprehensive school support that Danielle was mentioning is we do at the administrative level, we do a lot of like policy review, hopefully beforehand, but a lot of times it happens like midway where we find out, okay, there's actually a lot of policy things that are impacting student outcomes. And so that can be things like at some schools that historically had a zero tolerance for substance use disorders or zero tolerance for getting caught with substances on campus. We've seen how can we restructure that? So if you're caught with substances on campus, you're required to participate in services or in substance use treatment or in counseling and things like that instead of you're automatically expelled and then have to restart over with another school. So that's an example of policies that we really worked with schools to see if we can implement those. Another one would be to talking about zero tolerance fighting policies. Are there things that we can do to provide mediation beforehand? So pull in our staff if you hear that something is brewing in the school community. Can we do a quick mediation so that we make sure that it doesn't escalate to fighting and things like that? So just really how can we be central in revamping those policies so they include behavioral health interventions versus that exclusionary discipline? Um, we really do collaborate with school leadership to integrate services. And so oftentimes our best friend at the school is the dean. And so our staff will sit in with the dean as they're reviewing all the disciplinary things that come their way all day long and just saying, okay, hey, that's an area where we can provide intervention. Or when they're having meetings with parents because there was a disciplinary issue, that's an area where we can provide intervention. Instead of suspending them today, let's get them into therapy so that they have to do 2 times a week. They have to do classroom intervention. So they have a lot that they have to do. We're not coddling, but just making services that are more effective than suspension and expulsion and things like that. So really integrating into the administrative work and that policy revamping. We also request that we can be integrated into like any re-entry meetings. And so whether that's you're re-entering as a student from a hospitalization, maybe a foster placement, maybe you're leaving like a juvenile detention center and you're re-entering into the school population. We want to be like in your first meeting so that we can make sure um, we provide the services up front. And we know there's an issue here. Let's wrap around that student and that family so that we can prevent further things from happening. And then as far as the staff support, Danielle kind of mentioned too, just providing those trainings for the school staff with the understanding that we know behavior is communication. And so what are our students trying to communicate to the staff in that moment? So we provide a lot of training and a lot of interventions for educators so that they have some real tangible tools that they can take with them and they can prevent a lot of outbursts from happening so that they can focus on teaching. Most teachers just want to focus on teaching. And so how can we help to support them in that education and really teaching students? Some really helpful interventions for teachers that we've used are including like students that really need a break. Maybe they have very high trauma exposure and just sometimes get overwhelmed with their ability to cope in the classroom setting, and so they need a quick step out break. And so we've done things like if a student puts a post-it note on their desk that's informing you they need to step out, grab a drink of water, take a deep breath, and return back to the academic setting. that quick intervention has solved a lot of the outbursts that we've seen. And it's just a really quick thing that we can do to help students and to support teachers and to allow students to remain in the classroom longer. Yes, that's all I'll say about that one for now. And then really we embed these services in schools because we know that youth will advocate for themselves if they have a clear, trusted adult that they have found a relationship with. And so I mentioned before we have high expectations for our staff to be very intentional about the relationships that they're building with the students so that we can provide support to the students and then also create that pathway so that the whole entire family gets the support that they need. With that comes a lot of reimagining caregiver involvement. So this is sort of something we do with administrators a lot of times is to um, talk to us about what their caregiver involvement looks like. Many schools, when we first start working with them, will say, oh, our caregivers are very disengaged. They have poor attendance in things that we schedule for them. And we really talk about, well, how have you set that up to make it accessible for caregivers to participate? A lot of schools will have this amazing curriculum for parents and these great workshops they're bringing in, but they're at like 1 o'clock p.m. and no childcare. And they'll say, oh, well, nobody attended the workshop, so nobody cares. That's not true, and really wanting to work on that, dispelling that myth. Our families are working, and they're many times working multiple jobs. Many of our families are on night shifts where, well, 1 o'clock, they're not even like getting up yet. And so setting schools up to be accessible for caregivers, where can you provide childcare for some of those workshops? Can you provide food? Can we vary the times? Can we make sure that they're in a language that the family speaks so that they're accessible to caregivers? Um, so that's been something to really help the schools just to reimagine what caregiver engagement looks like. Um, with the understanding too that families have a real rational reason to be suspicious of the school settings. If we know that educators are the most frequent reporters to child welfare, and for Black and Indigenous families, they have a 50% chance of child welfare involvement. Well, like, why would they come? That's presenting more risk factors for them if they show up to schools. So, just making sure that schools can reapproach this in a different way. Something that we've kind of talked a little bit about with schools is can we reshift what engagement looks like as far as time? And so if our families are working multiple jobs, maybe showing up isn't helpful, but can our families that are on CalFresh, can they maybe donate something to the classroom? So instead of saying, oh, we need every family to donate tissue, that's not something that they're able to purchase on CalFresh. So can we make it so that they can donate water bottles or granola bars or something like that that they can purchase with their benefits to support the school setting? So just helping schools really to think through and sort of revamp what caregiver engagement looks like. In our trainings, we also focus a lot on making sure that we're not only calling caregivers when it's bad news. And so if the teacher can really work on, maybe you send a letter home introducing yourself on the first day. Hey, I'm Christina. These are what I like. This is where I grew up. I'm really excited for this year because, and then maybe you give the parents a chance to talk about some key things about their kids. Like leave an open space that says, can you tell me your kid's learning style? And allow the parents to participate with engagement that way. With the understanding our caregivers know their kids better than we do. And so they might be giving you some tips that can help you work with them throughout the year and just setting you off on the right foot. And so really want to talk about just turning that engagement into action. So we build trust. We've talked about how we revamp like caregiver approaches, how we revamp policies, but really, this building trust within the community, within the teachers and the students, it really allows us to link people to the services that they need at a faster and more successful rate. So with that, schools become just a very healthy entry point for families where you previously might have had a child welfare report made against you because your child came with dirty clothes. But now we've set up a school where you can just come in and grab laundry detergent, no questions asked. And that just creates safety for families and allows them to see schools as a community hub, like Danielle mentioned. Really, no wrong door, no wrong timing. However you get in there is how we can help you get connected to those services.
Beautiful. Thank you, Christina. You got a lot of hearts there. Thank you, guys. So just in line with what Christina was mentioning is, really creating those hubs within our communities. And so what we do is it's important for us to bring our services to our families because to Christina's point, our families are working. Sometimes they'll have multiple children and going to multiple places in LA is not fun for any of us. And so really taking that into consideration. So again, looking at that whole person, looking at the intersects within that person's lives and stop viewing not coming to an appointment as resistance on our caregivers' end, but more so a resistance on our end from wanting to reshape our services to make sure that they're meeting who they're actually meant to service. And so we do our due diligence to really bring all of our services on site within the school. And so some of our programs are like our cultural broker program, which is specifically for African American families, just to be an added support. No other requirement outside of residing in SPA 6 and being African American. And this is in partnership with our faith-based networks, just providing that additional support to navigate life, to really do a lot of that upfront prevention work from becoming involved within systems. We have our Stronger Together program, which is really our preventative legal services and family advocacy. We know a lot of our families become involved in systems and sometimes don't know what to say or what they can or cannot do. And so they'll have access to free legal services. Our maternal and infant supports. A lot of our families have younger children. And so we support them with linking them, if they choose to, of course, to our maternal and infant supports, just to ensure, again, that they have those wraparound supports, that we're co-located in these hospitals to ensure that the hospitals are aware that these families are okay, they don't need child welfare involvement, that they do have a supportive team around them to support them with reaching family goals and, again, ensuring family safety. Our substance use, we're co-located and have staff that are trained to support with that substance prevention as well as that substance use treatment, so we can link to outpatient services. If it's a youth, we have our adolescent services, which we can provide within the school and or at our actual treatment site. And again, that plans of safe care, which is really that co-location in the hospital to support staff with making the best choice for families when it comes to that decision of whether or not child welfare needs to be involved with those families, or if those families will be fine with just those community supports. For some of our schools, we do see that our babies have gone through some stuff and they need a little bit of higher level of support. So we are able and have been able to co-locate some of our evidence-based models on the school sites. So at some of our schools, we have our multisystemic therapy clinicians and our functional family therapy clinicians as well that are co-located. So this really goes beyond that individual support, but really focusing on the entire family. A lot of the times our first point of engagement is through the schools. However, we are able to provide these supports within the home setting, the community setting. So though the school, we use that as our point of engagement, we're able to provide supports wherever that individual or family feels most comfortable. We also have partnerships with primary care because we know a lot of our primary care facilities don't always have the same level of culturally informed training or trauma informed training, or they just don't have access to resources to link families to. And so we have sound partnerships with some primary care providers where our families can go receive that preventative medical care or that intervention level medical care to ensure that they're supported, that they're attending to all of those medical needs. And again, creating that trusting relationship, because we know also the medical world has not been a system of trust for a lot of our families, particularly African American and Indigenous families. And so really just bridging those gaps within systems for our families. So we like to do all the work for them so they can just walk through the door and get everything that they need without any fears or elevated fears, I should say. And then that care coordination integration, again, we like to do all the work so our families don't have to do a lot of work. And of course, that can be difficult at times. So I think this is not just a shift on the school side, but also through the lens of behavioral health, that as a clinician, you are doing what is needed to truly support that family and truly support mental health stabilization. And so sometimes that comes with calling DPSS. Sometimes that comes with knowing the food bank and taking your families to that food bank in order for them to sit in that session with you, right? And so it's really changing, and it's a paradigm shift across the board with all of our systems to ensure families are truly supported and they are at the center of our care.
All right, so this is kind of like how we make this work for funding streams and all of that good stuff, and then just how we keep it sustainable from making sure that these services can just maintain in schools. So the truth is we blend a lot of funding streams. So that's how we keep it sustainable. And so these are the ones that we use. So mental health services, we are funded through Department of Mental Health for LA County. So that does support that on-site behavioral health clinician. So they are billing Medi-Cal through Department of Mental Health for sustainability there. And then our MST and FFT clinicians are part of the FFPSA pilot program. And so through the state and then Department of Mental Health, they were able to fund training for MST and FFT clinicians, and then we can keep them in schools. Substance use services, so we are contracted through SAPSI with that family-centered care. And then SAFC has actually expanded into allowing field-based services, which is huge. They didn't previously allow that. And so we're super excited to be able to take our substance use services, especially for the adolescents, out into the field. And then SAFC's in the process of setting up MOUs with Los Angeles Unified School District so that more providers for substance use treatment can go into the school site. So we're really, really excited about that. We have enhanced care management, ECM providers through CalAIM. So we have lead care managers at our school sites. And so they are billing against Medi-Cal for that benefit of just sustaining and stabilizing mental health needs. We also have CCBHC funding. We support on-site navigation. So we have 3 care coordinators that are just funded through CCBHC to just serve as an entry point for families so that we can do a quick assessment of what's needed and then get them linked to the appropriate services. We have been able to leverage the California Community Schools Initiative. And so we have over 4 schools that are in the community schools partnerships model. And so we have been able to sit with 2 of our charter schools to be part of their grant. So they've actually written us into their grant to be the school-based provider for resources and that community linkage part. And then for CYBHI billing, we did 1 round of the Haluna grant through CYBHI, and that funded 1 FFT team in the schools and really allowed us to increase our engagement with families. So that was very, very helpful to build the relationship with families at two identified schools that we targeted because they just had the highest need and the highest population of African American students. And then right now we are doing the CYBHI fee schedule program. So two of our charter systems, they each have three schools. Our staff at those schools are now doing the fee schedule program to just make their school-based services sustainable. Both charters are absolutely loving the clinicians being there and having on-site services and being able to link families immediately to services. So that's been great so far. And then we do leverage all of our Shields resources. So Danielle kind of mentioned the like preventative legal, plans of safe care, cultural broker, our vocational services. So all of that is within Shields for Families. And so we're able to do the interagency linkages. And it just really supports like having that one-stop shop for families where they don't have to navigate all these different services and systems.
And we would not be anywhere without our collaborations.
Yeah.
So child welfare is a huge one for us where we have great relationships and partnerships where we're able to co-locate staff and or our pilot programs with our PLS program. I do want to highlight that we are also at Children's Eldamans Court. We have a staff that is co-located there. They are wonderful and they've provided us with an office space. So we're on site 4 days out of the week. And that's not only for our families that are enrolled in our program. Anyone that has a child welfare case that needs support or navigation can walk into our office and get support. So we do a lot of cross trainings. They provide trainings for us. But just being there and being a resource to really support families has been key for us. We also partner, and I think it's on the next slide. We can go to the next slide, but maybe yes. So we also partner with Compton Court Commissioner Ashley Price's courtroom. Who has done some amazing work with families, really moving away from a cookie cutter approach for families that are child welfare involved and creating an individualized court plans and case plans for families and doing immediate linkage with community partners. So as soon as someone comes in the courtroom that day, we are receiving an email or a phone call. Hey, this family needs this, this, this. Can you link them? And then we really have that relationship where we contact immediately, link them into services so that family can close that case faster than a typical case would be closed. And again, it is not cookie cutter. So they are only being assigned services that they actually would benefit from as a family. So that has been key for us as far as like our partnerships. These are some of our other partnerships. I mean, again, the hospitals have been key for us being in there, being able to provide support bedside for a lot of our families and provide that cross-training support for the staff there as well, which is key, right? A lot of the times the calls to DCFS happen because individuals don't know about the resources available within the community. So the fact that we're able to be co-located, it is a warm handoff immediately to families, and people feel more confident in that decision to pass over and not make that phone call. These are some of our internal programs, our Healthy Families America, Parents as Teachers, our MST FFT, and all of our staff are trained in motivational interviewing, which is helpful with that engagement with our families. Oh, yes, see, yay, DCF, yes, Vermont Corridor, yes.
Yeah, in the house.
Yes, we love you guys. But yes, just having these partnerships for sure have supported. And these partners are all intentional about the change that needs to happen within our community, the change that needs to happen for our families. And so we are also very intentional about partnerships. While there is a long list, that it is intention behind the partnerships. Not only are they key systems that our families are involved in, but these are key systems and stakeholders that want to see the needed change to support our families. And so we're very excited. Public Counsel has been a huge partner as well, with just providing like those legal supports for our families. And with this and with the access to all of these support systems, there is a lot of shared resources, not only to staff, but again, to our participants within the program, where they're able to get the education, they're able to get the language, and they can pass it on within their communities. So others that are impacted may not have the same experience, because now they have the knowledge from their peers within the community as well.
All right, so just really aligning these practices with the California's prevention plan. Um, the whole plan is to strengthen community pathways, and we believe that with this school-based approach that we can intervene early, reduce system involvement, and really allow the families to be at the center of the decision making. And so our thoughts are that this family-centered treatment engagement really does connect families to the prevention services that they need, and just serves as an amazing entry point. What I always say I love about schools is that you get to work with families that would never walk through a clinic's door. And I absolutely love that. And I think that's such a crucial point to provide these prevention services there.
Absolutely. And Chris, that was like the best line to say like on this one.
My bad.
But no, so just really, again, just highlighting schools and the importance of schools. This is where we have access not only to the children, but we have access to our families. And again, families not just being those biological caregivers, the foster parents, kinship placements, whoever else they identify as family. I always say our staff are like the nosy aunties and uncles that are going to annoy you because they're going to be in your business nonstop. But this really allows us that pathway to really work with one another and bring families in, and change that narrative about what the school system is, what mental health, behavioral health means, what it is. And so really changing and shifting that narrative for our families. With this practice, we really change the voice. We leverage community resources. The goal is not for our families to always need us. The goal is to, of course, work all of ourselves out of a job. So they don't need us anymore. They don't need these resources. We want the community to understand the strengths within themselves and build off of those resources. But the only way that they can do that is if everyone has that shared language, everyone has that shared knowledge, and that support built within the community in order to effectively showcase that and tap into those strengths. And with this work, we have seen a significant impact on involvement overall within systems. We've seen a shift with our schools in the disciplinary approaches with our students. And so we know ultimately the impact that this is going to have on systems is going to go far beyond, I think, what any of us can imagine, because we are, like Christina said, we're reaching families at that prevention point. So while those that are in the intervention stage really were the ones to bring us in, they're allowing us to do a lot of prevention work. So families continuously are reduced with their interaction within the child welfare system or that juvenile justice system. And I think we did it. We're good, guys. We finished and got some time for Q&A. I'm so proud of us.
It doesn't always happen, so.
It doesn't. But we thank you all. Thank you for your presence here. And yeah, we'll open for questions, comments, feedback.
Can I just ask?
Yes.
Okay. Hi, I'm Shayna from Santa Barbara County, and I was curious, how are you, obviously you guys are doing a lot of restorative work because you're talking about the school to prison pipeline. How does that kind of, because I saw you have a lot of clinicians and case managers and things like that. How are you incorporated the restorative justice or school-based restorative approaches in your work?
Yeah, I didn't know who was going. I'm like not a Zoom person. So I think it looks different. So some of the schools actually follow like a restorative justice like practice model where some schools use different things. For us, we really just meet with each school individually to see what practice best fits them, and then again work through those policies and procedures. So if someone's sleeping in class, right? Are we going to give them a detention and kick them out, or can we have a conversation about, okay, what happened? Why are you sleeping in class? And let's set up a plan that's going to support this student. For some of our youth, we've had youth that are gang involved, and sometimes in opposing gangs. We know that information when they come in. And so us being upfront and having those conversations with both of them, setting expectations within the classroom environment, but also equipping our educators, our staff with what to do, what to pay attention to, what you should bring to the attention of your administrator or behavioral health clinicians that are co-located on site. So we definitely do just that cross training across the board. I don't know, Christina, you have probably more specific examples.
Yeah, as far as restorative justice goes, like the true model, a lot of schools in our experience say that they do a restorative justice, but don't actually have like the infrastructure in place to do
Mhm.
it. And so we support with like a lot of mediation. And so Danielle kind of mentioned it, but we become the nosy aunties and uncles, which is 100% facts. And so we learn about things or we hear little whispers of like, oh, something's going on, and we pull people right away
Mhm.
and say, can we provide some intervention? Um, what can we do to mediate this situation? Sometimes it's as simple as you stay over there and just like stay apart. Other times it's like, okay, something actually did happen and can we have a repair there? So it varies by school.
Mhm.
But I will say, as much as we can, we're trying to like bridge those gaps. So there's not an automatic, you see a kid sleeping in class, you automatically have this response.
Mhm.
Understanding that families are complex, there's a lot going on. And so can we get to like the real root of the issue versus just disciplinary practices?
Mhm.
Thank you.
Hmm.
No,
I
no
mean,
worries.
and I think it's oftentimes, as you said, people think they're doing restorative, but they're not because it's the whole system, it's the whole
Yeah.
Mhm.
school,
Hmm.
and then it's like the individual work, right?
Yeah.
But there's layers to the restorative practices. So thank you.
Absolutely.
Appreciate
Yeah,
that.
and there's so much there that to that point a lot of times schools are like put them together in the same room and we're like no, we got to first like do some individual intervention to see if they're even able to sit in
Able.
the same room
Mhm.
at that point. So a lot of psychoeducation there first.
Thank you.
Yeah. I see Sarah
Yeah,
had a
thank
hand up.
thank you both so much. That was a great amount of information and super helpful. I'm curious about the length of time it took to set up the programs, right? Like this had to take years upon years. And then maybe some of the challenges you encountered along the way would maybe be helpful for people thinking about something similar.
Mhm.
That is a great question.
Yeah.
I will say, like the in the initial phases, some of it was really, really immediate. Just because I will give you a very just vivid from my experience. We had a wonderful family, but one of the youth had a lot of externalized behaviors, going on the roof, taking a knife, throwing desks, punching, fighting, just every day. And so the school, this is the first and only school that I ever had a parking spot assigned to me in the front of the school because they're like, we need you here every day because something is going on. And so, really, from that point, we were able to say, okay, this is not just this one family, this is all of our families. And so, because the need was so high from the school, they were just ready to go. They were like, anything you need, whatever that looks like, let's do it, because we can't have this happen every day. We can't afford like this kid to get injured or other kids to get injured. So they were really, really immediate in their response and openness to really create. I will say this was like pre, like it wasn't as formalized, a while ago with like, okay, really the SDAs were later on when it came to the individual schools, like having the MOU, and the schools had a little bit more flexibility to just create the structures as they needed within the classroom setting. I mean, within their school setting. So we had a lot more flexibility. But from that point, schools definitely shared like, oh, you got Shields kids too? Well, they're doing this for us. And then the schools will say, hey, we heard you're doing this at that school. Can you do that for us at our school? And so it really just happened overnight for us, just based off of our response within the school setting. Now, I would say just because we've been fortunate enough to be within this community for so long, schools know about us, they know what we provide. And so now the process, what, 2 weeks, a month in some cases, that we can get it up and running. Our challenges, I don't know if we have no. I mean, I think the challenges is just that paradigm shift, into understanding where people, as a whole, are understanding we're not taking accountability away from behavior. We're saying let's create a space where first children have the language to know what their emotions are, know what they're feeling, learn how to communicate, and have a trusted space in order to be able to do that. So that takes a lot of work and dedication, on everyone's end, a lot of extra work, all that pro bono work. So I think that has been probably the biggest challenge overall. Just collectively, we all have to be on the same page. It's not about who's right, who's wrong. It's about what's needed. And so it's always recentering the conversation back to, it's not that we're right. It's not that you're wrong. It's, this is what these youth need right here and now. This is what this generation needs here and now. This is what this demographic needs here and now. So what can we do to compromise, work with one another so everyone's goals are met? We know a kid can't sleep in the classroom, right? Like if someone was to walk in and see students sleeping in the classroom, that educator would face consequences, right? And we don't want that to happen. We know there's a student need. So what can we do to make this work for everyone involved? And so that's been our approach. Sometimes the journey is a little longer in certain places, to get everyone on the same page, but I would say that's the biggest barrier I've experienced.
Mm-hmm. Yeah, the only thing I would add too is at least in LA County, our districts are huge. And so it's harder to get something going on like the district level. It's been much easier and more successful for us to do like the relationships with the individual schools. So for example, LA Unified, we have an MOU with the whole district, but our relationships and our like intensive services really go to the individual schools that we have close partnerships with. And so that makes it like manageable for us, but also we're able to tailor to that specific community versus like a district-wide intervention would be really difficult and I think would take us away from like the point of what we're doing.
So I just wanted to make a comment because I used to also do services at school based from my agency before. And it is true, the school has to put their part if you want to do like success in this type of work. From experience, I had I was doing individual rehab. So I was a case manager doing individual rehab services. They didn't have the space, the appropriate space. I remember there was one room that was so dark. I'm like no, like and I'm like, no, like that's why it's like really good that you guys are doing this because the school and also the agency, they have to collaborate because even the space that you're gonna provide the services makes a difference as well. Yeah, I don't know. I just want to comment that.
No, thank you.
No, yeah, thank you for sharing. Space is just like in LA in general is just a challenge. So yeah,
And
for
yeah, I
sure.
was in LAUSD. So yeah, it was I started class 6 as well. So yeah.
Yes, yes. But I will say, we definitely go in with like, we are not, you can give us a janitor's closet and we will take facilities, and make it nice because we also understand sometimes schools have also a mistrust of behavioral health systems as well because some people have come in, have promised, and have not fulfilled. And so they're like, before I give you this big space, we want to make sure X, Y, and Z is going on. And so we understand that as well, right? There's 10 sides to every story and every experience. And so we come in and really say, like, okay, whatever you're willing to give us, perfect. And then we slowly like infiltrate and and expand. We're like, see, here's some donuts and here's some Tide. And then they've been gracious. We've been fortunate enough to get, in some cases, whole classrooms, and that's been amazing. Come in and provide morning meditation within the classroom setting. So the teachers have 30 minutes to get it together while we're facilitating meditation. So it is a give and take relationship. And some of these things we're doing under our pro bono lens for the benefit of the greater outcome, ultimately. So it has to be buy-in too from that behavioral health provider as well to provide those pro bono services that aren't typically able to be captured, which usually falls on like admin staff to come in and do. Yes.
All right, Jewel, I think this might be our last question.
Well, actually, it's just a comment. So my name is Jewel, and I worked in Compton Unified for many years and was coordinated services with you. And I just want to say you were always so community focused, and it really made a change in our community. And just, some of those things that you were doing then were groundbreaking now. We're just seeing that in some of the schools. I'm now at the County Office of Education, and so much of that early work is now what we see working in schools. And so just want to applaud you for all the work that you're doing and continue to do in the communities to serve our youth.
Oh, thank you so much.
Yeah, thank you. And thank you I saw in the chat, thank you for their assistance with this CUSD one. We're still, going strong over there, and we love our Compton Unified people. So thank you.
Yay!
Yeah. Yeah.
Glad to hear that. That will always be my family. I've been at the county office now 15 years, but
nice.
That was really early groundbreaking work in Compton Unified.
Yep.
Oh,
Yep.
thank you.
I
Yep.
have one of their social workers on speed dial. That's my yeah. So thank you.
Thank you.
Well, thank you, everyone.
Yeah, thank you all. Thank you all for the interaction, the hearts. I got distracted at first. I was like, ooh, but I really appreciate the interaction from everybody. And thanks for letting Danielle and I join.
Yes, we appreciate you all.
Thank you both for joining.